Thanks so much, everyone, for taking the time to join us today. I'm Carol Bush, Director of Impact for Komen, Kansas, and Western Missouri. I have some really special guests I can't wait to introduce to you and also share some information. We work every single day to end breast cancer, not just during October. And one of the best ways you can stop breast cancer in its tracks is early detection, right? So first two things we want you to remember: know you're normal and get screened. So the signs of breast cancer we know are not the same for all women. And it's important to know how your breasts normally look and feel. If you feel or see any changes in your breasts or underarms, you need to have a conversation with your physician. And consider getting a mammogram. So we can talk about that a little bit, but a mammogram is an x-ray that examines your breast tissue, and you should get one every 1 or 2 years. If you're younger than 40 and you have some risk factors like family history of breast cancer, you may also need a mammogram, and you do need to have a conversation again with your physician. One thing we want you to know, whatever your age, and especially in the lens of a pandemic, don't avoid getting a screening or a mammogram because of cost. And one of the most common questions we get through email or our website are, where are some resources for free or low cost screening mammograms? And I'm so excited today to have with me a couple of our stellar colleagues and partners with the program Early Detection Works here in Kansas. So what do we have in our country? We have a great resource through the CDC, or Centers for Disease Control, and it's focused on early detection of breast and cervical cancer. All states have this, including some tribal territories as well. And here in Kansas, it's called Early Detection Works. I say here in Kansas because I live in Kansas. But in Missouri, also, we have access to that through Show Me Healthy Women. So this is going to be actually a 2-part interview because there's some access. The way things are run are a little bit different because each state department can contract with the CDC. And today, I'm joined by my good friends, Anna and Chevelle, with Early Detection Works, and they're going to tell you a little bit about what Early Detection Works looks like here in Kansas, what you can expect, and help me dive into the information a little bit. So first of all, welcome, Anna and Chevelle, and just real quick, say hi to everyone.
Hi, everybody.
Thank you for having us. It's a pleasure and an honor.
Oh, you bet.
Here today.
I can't wait for everyone to get to know you. I actually know a lot of people in our state already know you very well. So first, I really want both of you just to introduce yourselves and tell us where in the region you work or headquarter, and a little bit about your role. And so Anna, I'd love for you to go first, and then after that, Chevelle.
All right, well, thank you for that very informative introduction. But yes, my name is Anna Guillen. I am a registered nurse and have been since 2013. I work at Genesis Family Health for the Early Detection Works program. Genesis Family Health is a federally qualified health center. I am located in Garden City, southwestern Kansas, but the clinic does have 4 sites out here in Western Kansas, one in Garden City, Dodge City, Ulysses, and Liberal. And I am the regional nurse for the Early Detection Works program.
Wonderful, good. So Chevelle, tell us a little bit about what you do, where you are, and your role with Early Detection Works.
Yes, so my name is Chevelle, and I'm the EDW enrollment specialist. I'm located in the Kansas City area. and I work doing the enrollments for the program. So I work really close with the regional nurses. So we have 4 regions for the program in the state. So I work really close with them and doing the enrollments and navigating the patients, connecting them with the clinics, their providers, and see what they need.
Awesome. So I love this because as a nurse, I love that there's a team approach and that we have enrollment specialists, community health workers, and regional nurses all focused on caring and connecting folks to services. Excuse me. So now you talked a little bit about what you do, and we're getting this feel for that there are regions and there are partners and providers. So maybe talk a little bit more about what do you value most about your role, and a little bit more into how you help women with early detection works. And Chevelle, I'll have you go first, and then Anna.
Absolutely. Well, what I value the most is having this resource to share with the ladies. Sometimes they don't even know that they qualify for the program or how easy it is to access and to be eligible. So doing that, following the protocols, explaining the guidelines, the requirement, and what they need to do, and what happens if something is abnormal, follow up. I really enjoy that, and having this resource and sharing it with the community. That's my top one.
Awesome, wonderful. So Anna, what about you?
Well, yeah, I just echo what Chaveli says, just being able to be that resource for women and to just like the program's name, Early Detection Works, you know, just to be able to offer those valuable screenings to women, whether it be for breast services or cervical services. Like you said earlier, just the teamwork, the network between the nurses, the enrollment specialists, the outreach workers, just trying to get out there and get these women in to be screened and you know, stop the cancer in the early stage.
Awesome. So I think that both of you mentioned something about eligibility. So one of the maybe most frequent questions might be, for myself as a nurse who's practiced in the rural community, I've been aware of early detection works for many years. But I do know that not everyone is aware that it is a resource that's available, and it is for income eligible, uninsured, and underinsured women in our state. So Anna, I'd love for you to talk about a little bit about how would a woman know that she's eligible or not?
So the easiest way is usually just by calling the toll-free number. Out here in Western Kansas, we have a direct line, and it would be 1-877-275-5302, which is the toll-free, or they could just call our direct line, which is 620-275-5302. And so they would just give us a call if they just have questions or they think they might qualify. There's just a couple demographic questions that we ask, history, and like you said, to be eligible, they've got to be 40 to 64 for breast services, 21 to 64 for PAP services. Again, if there's anything, any symptoms, any question, any issues, they can give us a call. Like we've got 4 regional nurses. So more than likely we can address any questions, issues you might have as far as eligibility and get the woman enrolled.
Okay, very good. So Chevelle, now you explained to us that you're an enrollment specialist. So when a woman calls that 800 number, what, talk a little bit about what she might expect from the enrollment specialist part as well.
Absolutely. So that process, that call can take between 7 to 10 minutes, and that's all. So
Wow, that's awesome.
we try to do a really fast process and be really specific. So as Anna said, we ask some demographics like the address just to verify that they are a Kansas resident, family history, and if they ever had mammograms or services done before, and if they have a primary care or a clinic that they go to. And then I put everything on the computer, and then the computer generates a code, which is the enrollment ID number. So then I provide that number to the patient, and then I guide them on where they have to call to schedule their appointment and their follow-up. Now, with Anna's region, it's a little different because she's connected to this clinic, to Genesis Family Health. So they are actually, they can, after they enroll the patient, they can schedule their appointments for the patient. But in my case, I provide the patient with the enrollment ID number, and then they have to call the provider and schedule their own appointment. But it's a really fast process, in 7 to 10 minutes the most.
I love that because I think, and as a nurse, helping patients with like treatment assistance or financial assistance, a lot of times there's a lengthy form, you have to fax or email back and forth. 7 to 10 minutes, that's amazing.
And
Also,
it is
oh,
what they report to us. We don't require documentation of any sort for
mhm.
the initial enrollment.
All right, so it is in that interview process and reporting the income eligibility is just the interview of the woman or the patient. And I think you both mentioned, the provider. So Anna, you're connected with Genesis, so you've got the clinic there. But talk a little bit about. I understand that there's a provider network. Is that correct?
Yeah, so I got some rough numbers. And so across the state of Kansas, we do have 291 providers that either provide breast services, services, mammography. Along with that, we do contract with lab companies to be able to be sure that we can pay for the PAP services that are being done, radiology groups, since there is two portions when a mammogram is done. Since we do cover screening services, and if something comes back abnormal, and if there are certain diagnostic testing that a woman needs, there are certain procedures that we cover. So again, we do contract with various anesthesia facilities just to make sure that we cover the whole procedure for the woman, and she's not left with bills here and there for certain services that we do cover.
Mm-hmm. And so, Chevelle, you mentioned that when a woman enrolls, that she's given a code, and then she needs to make that, take that code, much like we would our insurance card, right? We all have a number associated, whether it's Medicare, Medicaid, or private insurance, same thing. So are you able to connect her to a provider in the network in her region then?
Yes, I provide the patient with the clinic's phone number and their address and everything they need, so they can call and schedule their appointment with the provider. Yes, and the code is good for up to 6 months. So that way we make sure that they have more than enough time to do all the process to a schedule, because they have to do the CBE, the clinical breast exam first, and then they have to go to the hospital or another provider to get the actual mammogram.
Mm-hmm. Perfect. So you both talked a little bit about partnership with providers, but also mentioned like outreach and helping to leverage awareness for early detection works, possibly in your region. So can you speak to some of the ways? I know that you're talking with women on the phone a lot, but and in light of our lens of the pandemic, it might look a little bit differently, but maybe talk a little bit about other partners that you work with in the community, and what does that look like to help women learn about early detection works? And
Yes,
Chevelle, I'll let you.
yes, here in Kansas City, I've been working with El Centro, and they have been scheduling mobile mammograms. So I send them the enrollment forms, which is kind of the application that we do over the phone with the computer. So then I send the form to them, and they pre-screen the patient, and then they forward me those enrollment forms. I put them on the computer, and then I tell them if the lady or the patient qualifies for both or just the mammogram portion. And then they schedule or they coordinate this with diagnostic imaging. And then they bring the the mobile unit to their facility, and then they schedule that. They follow the protocol with mask. They do by appointment only, and they have to clean the van every 30 minutes. I mean, after each patient. So they have to schedule every 30 minutes, and it's a different protocol, but it's been working for us here in KC.
Good. I love that you have trusted partners that you work with in the community, and it sounds like you've all worked really hard on a nice referral protocol, so women aren't having to chase things all over.
Absolutely. Yeah, it is a team effort. Everybody does a piece, and it comes beautiful.
Wonderful. And Anna, tell me a little bit about what outreach looks like in your community. I think you have like an army of community champions, if I'm.
Yes, we do out here with the Promotoras de Salud, which Irma, who is my outreach worker, she has these group of women who are part of the community. They're basically community health workers, and they learn different programs as far as breast screenings, resilience training, things like that, just so that they can go back out to their own community and spread the word about whatever they've learned. And since they're a part of their community, they're more trusted. Sometimes people are a little afraid to go to a doctor just because they're afraid of what they're going to find out, or because they don't know, they're not educated. And so they go out into their communities and inform these women on you know, the valuable resources that we do have here at Genesis and with the Early Detection Works program. As far as our outreach right now, just with the whole COVID pandemic, a lot of our outreach includes health fairs, going out to those and providing information on the program and breast and cervical cancer screening. Just haven't been able to do those, unfortunately, but hoping to still with this and get the word out there on the program and get women enrolled.
Perfect. Well, and I think that you brought up a really good fact is that even though with a lot of information and awareness and messaging, people are still afraid. They're afraid of what they might find, so they delay getting a mammogram. And I think it's, again, thank you so much for joining me today, because I want women to, you know, understand that, you know, don't delay getting the care you need, that it is safe, and that people are working hard to follow all infection control guidelines, as well as that we have folks in our communities who are there to support you, I think, as well. So one of the things to think about, again, when people say, you know, I'm afraid of what I might find, but it is, again, early detection does help us, you know, lend itself to, if something abnormal is found, then we can proceed with treatment. And like you said, Anna, through Early Detection Works, we are fortunate to have Encompass that folks can go right into Medicaid because of our legislative action through the treatment program. But if a woman does have an abnormal mammogram, so have their screening mammogram and the radiologist says, hey, I think you need some follow-up studies, talk a little bit to us about what if there is a recommendation that a woman needs a diagnostic or further testing after her screening mammogram.
Yeah, so normally the report will go back to their primary provider who did the clinical breast exam, and it'll say something's abnormal, or they just want to look at something a little bit further. So the program does cover diagnostic imaging as well as breast ultrasounds. Again, depending on what the results are on that further imaging, there are certain types of biopsies that we do cover. And like I said earlier, our providers that we network with are really good at knowing which biopsies we do cover and which ones we don't. By any means, we don't want to influence any provider on what their recommendation is as far as what they think the woman needs. But if it's something that the program does cover, we do cover breast biopsies, normally like ultrasound guided biopsy or a stereotactic biopsy. So really our goal is to get the gal to a place where she's clear. It turns out that it's just something benign, or if unfortunately she is diagnosed with a breast cancer, like you mentioned, we do have the Treatment Act that we can apply for them and get them enrolled in that, and then CanCare will pick up the from the treatment or from diagnosis date onto treatment.
Mm-hmm.
Yes, and adding to what Anna was saying, if the patient needs 6 months follow-up, we'll cover those, or yearly mammograms. Now the guidelines is starting at age 40 through 64 for breast every other year. But if they have first-degree family history or symptoms or abnormal testing, then we will cover yearly mammograms, or depending on what the provider said, every 6 months, or whatever they say for the patient.
Mm-hmm.
And the same for the cervical screening.
Perfect. So it's not always just a one-time, thing. It is actually you develop a continued relationship with women because you're working on follow-up and coordination with their primary care physician as well. I love that. I think a big message for people is also don't be afraid to call if they have questions, because you're there, the enrollment specialists and nurses, and you work in concert with primary care providers, because we all want women to be taken care of. At the end of the day, that's what we're interested in. Definitely.
And just to add on Chaveli's note, like she said earlier, the enrollment numbers are valid for 6 months. So if they do have that 6-month follow-up, they just need to make sure to call myself or Chaveli or any of the other regions wherever they live in and get reassessed. Just that little 7 to 10 minute process, probably a little bit shorter because we've already got the demographics done. Just update the info, and as long as they're still eligible, we give them a new enrollment number, and they're all set.
It's a pretty easy step, actually.
Perfect. So I think that even with these great services and care coordination and a provider network, there still are unmet needs. Like there are still some challenges. And I'd love to know a little bit about what are some of those challenges, and how do you work with your partners to find solutions so women get the care they need? And I don't know.
Have you seen any in your region?
I'm sorry?
Have you seen any in your region? The most
Right now, I guess the challenge would be just the COVID pandemic and women being afraid to go out and get their screening mammogram, or even just go to the doctor to get their yearly exam. We do try and reassure them that, you know, clinics, hospitals are taking all the necessary procedures to make sure that, you know, that they're being as careful as possible, and minimizing the amount of flow throughout the facilities, you know, wearing masks, hand sanitizer everywhere.
Yes, what I've seen is for, well, I wouldn't say for my region because I work with all four regions in the state. Yeah, but I've seen the language barrier for those Spanish speaker. Um, they sometimes decide to go to a different clinic that is a little bit further from their location because they have bilingual staff there. And I've seen that some providers have taken the decision to hire bilingual staff or have community health workers. So now they're implementing. I've seen a few providers implementing community health workers to address and tackle this barrier, but that's one of the common one that I kind of always see.
Good. I love seeing that we, as a community whole, like, you know, our whole region, really focusing on the needs of all people, all of the people who live in our state, and putting solutions in place. And it's nice to be creative also. For example, building the Promotores program, the community health worker program, specific for the community to really engage that trust, because we all like to do business with people we like, know, and trust. And what better way than your friends and neighbors, I think, to help.
And also the EDW, we have the Spanish line available. So when you call the 877-277-1368, you press 2 for Spanish, and then you have an enrollment specialist that speaks Spanish. And also Anna, she speaks Spanish. So when we have Spanish speaker that need follow-up, or it's a kind of a hard question that I need the nurse approval or something, then I will refer them to directly to Anna, because she can be a nurse and she can be the interpreter. I mean, she can offer the services in Spanish. So it's a really good way for EDW to provide the services for the patients in the region.
That's great. I love how everyone works together. I think that's just a huge value. So I think while we're getting ready to wrap up today, I want to make a little bit of a call to action. So first of all, Chevelle, what's one way you think women, that you'd love to see women take action?
Well, just knowing when they are due for the next exams, because sometimes they forget, or they didn't put it on their calendars. They're like, well, I had my mammogram a year ago, and when I check, it's 3 years ago. So put it on your calendar. That way you know when you had your last screening, and that way you know when you need to do your next one. So putting it on your calendar and calling us before your appointment to get approved.
I'm guilty of that. I seriously am. Time flies, right? Oh my gosh, it does.
Yeah.
So Anna, what would the action that you'd love to see people take?
Yeah, just get out there, be your own advocate, you know, speak up, go to your provider, ask what screenings you're due for. I know we're just discussing breast and cervical right now, but there's so many other, you know, screenings that you can have done to catch any other types of cancers early. Yeah, just speak up and use us as a resource. And even if you call us and you don't qualify, we can probably point you in the direction to another resource, another program that might be able to help and get you your much needed screenings.
Yeah,
Wonderful.
and sharing the information.
Mm-hmm.
Yes.
And that's one thing I really love about our region is we have a great history of all working together, and we email, call, you know, help women get connected to the resources they need. And as you said, it's not just we're not just about breast. So breast, cervical, colon, you know, everyone needs to get their screenings. So I'm just going to review a few ways. So as individuals, we definitely want you to get screened and know you're normal. And if you something is abnormal, something doesn't feel right to you, please have a conversation with your healthcare provider. And if you are listening today and you've learned something about early detection works, and, you know, here's the thing, folks, people have lost their job and their insurance may have been attached to their job. So they may need resources like early detection work. So if you know of a friend or neighbor who might benefit, share the 800 number, which we'll have in the comments below, as well as the link to the Early Detection Works website. And I think another thing is maybe you're a provider, and you're not in early detection in the Early Detection Works network. So Anna, how can providers get set up with you?
Yeah, so they can go to the website. Like you said, it'll be in the comment section, and there's a section for current providers, or if you want to become a provider. Basically, all the info is on the website. There's just a contract that you read through, fill out, submit to the state. If you have any questions, you can give me a call. And if there's any questions that I can't answer, I'm sure I can get you to the person who can answer those questions. But yeah, it's a very simple process.
Awesome.
We'd
And
love
so,
to have more providers.
go ahead, Chevelle.
I said that we'll love to have more providers in the state.
Yes, exactly. Cover all the corners, definitely. So one final call to action today, in addition to if you learn something, share. I want you to share this video in your social, across your social network. So you may be listening to it on Facebook, share it across Facebook, as well as there's a follow-up blog post that goes through more information that will be on our website, and the link will be in the comments. And finally, we'd love to have you join us as a Komen advocacy champion. And just a reminder that we do have Komen Center for Public Policy and Action, and it is a nonpartisan voice for 3.8 million breast cancer survivors, those living with the disease and the people who love them, through that Public Policy Center. So I'm going to include the link, and you can join us in advocacy, as well as, very key, that as the 2020 election nears, we are calling on you to consider the issues, because we believe everyone deserves access to timely, affordable, high quality breast health care. But the reality is, and you heard today, not everyone has access to those services. So key patient protections will continue to be threatened in the budgetary negotiations. And we need you to work with us, because one of our key priorities is to strengthen, and actually we're asking for additional funding for the National Breast and Cervical Cancer Program. So we want you to join with us to make sure the funding stays the same, and actually we're asking for increase. So I'm going to include the link. We'd love for you to join so you can get Advocacy Insider email blasts and advocacy training, and learn how to educate legislators to take action. And additionally, we are calling on you to consider the issues as you're preparing to vote for candidates in the 2020 election. and the Civic Engagement Center for Komen, and there will be a link in the comments, will help you do some research so you can look at the candidates who support access to timely, affordable, high-quality breast health care, and you can make those selections when you go vote. So thanks for sharing today, Anna and Chevelle. I consider you not only personal friends, but thank you so much for your leadership, the way that you work and serve your communities. And I know that we'll probably have more interviews like this, more information. Today, I just really want to ask everyone to go take some action right now.
Give us a call.
Yeah. Thank you so much, Carol. We enjoyed the time, and hopefully we have more meetings, more interviews in the future. And yeah, just give us a call and see if you qualify.